legs. And then, to stop the bleeding, he used this, a cauterizing iron. He was desperately looking for something better.
Paré was a compassionate man, and he worked on a range of wonderful inventions. Many were attempts to compensate for the limbs he had had to cut off.
My favorite is this. It's a sort of mechanical arm with flexible fingers.
But in the end, the solution to the real problem, blood loss, was something incredibly simple. A piece of thread.
This is called a Kresbeek. It's actually one of his inventions. What he did is he would clamp off an artery with this end. Then he would get a fine silk thread and tie off the artery. And that is his great discovery. That is his unique contribution to surgery, the ligature. You'd imagine it would have taken off immediately, but in fact, 100 years later, surgeons were still using boiling oil and cauterizing wounds.
It was not the first time that surgeons were slow to adopt something so obviously beneficial to their patients. Nor would it be the last. I really admire innovators like Paré and Vesalius. They questioned conventional thinking, were ridiculed, but struggled on and eventually found a better way. And it is truly remarkable how, after centuries of no progress, within a decade, two men had overcome two of the great barriers to modern surgery. However, just as surgery looked as if it was getting going, it stopped.
Fundamentally, surgery didn't change for an incredible 300 years. In fact, there was no real progress at all until the 19th century, when industrialization began to change the world.
Mechanized work meant new injuries, limbs ripped off and horrible fractures.
This boom in demand for surgery collided with the Victorian age of invention, and it produced two enormous innovations, which between them would transform the butchery that was surgery into something we would recognize today.
Welcome to the first edition of Dateline World.
We're right in the middle of this. This is bad.
I can't film openly here, so I'm going in with a hidden camera.
People said it was a broken promise.
Yes, they do say it.
Dateline, now on Sunday at 8:30.
Some banks talk about no fees on their everyday banking. But on closer inspection, you could find all sorts of transaction fees and conditions. But with ANZ Access Advantage, there are no hidden surprises. Get unlimited ANZ transactions, all for simply $5 a month. For more convenient banking, click, call or visit us.
Are you a motoring enthusiast? Does your current insurer understand your passion? At Shannon's, we're motoring enthusiasts, just like you. We understand the passion you have for your special car or bike, even your daily drive. So if you're a motoring enthusiast, you've got to be with Shannon's, because insuring motoring enthusiasts is all we do. So call Shannon's on 13 46 46. Shannon's, insurance for motoring enthusiasts.
Don't miss your chance to win one of 21 luxury holidays around the world in the Australian from February 7 to 27. Grab an entry form starting this Saturday in the Weekend Australian.
In 1840, if you were unlucky enough to need an operation, you were almost certainly conscious throughout.
The discovery of pain relief, or anaesthesia, would be the third great barrier to be overcome.
What I find really bizarre is Victorian surgeons had access to a range of pain-relieving techniques, which they obviously chose not to use. Was it perhaps because they didn't work very well? I really want to know, so I'm going to try out a couple of these techniques on myself. I'm going to start with something which I am very interested in, but which I'm also deeply skeptical about: hypnotism.
We're going to be exploring how we can help to numb your hand during hypnosis, how we can deal with pain. First thing I'd like to do is find a baseline to measure it from.
Okay.
So what we're going to do is we're going to attach this, it's a peripheral nerve stimulator,
okay,
and we're going to put this onto your wrist. If I just put this about here.
And the person who's going to put me under is hypnotherapist Tom Mackay.
Just going to make all my... I'm ready.
Excellent. Okay, here we go.
Jesus.
That's
that's
maybe
like
a little bit higher than...
No, that's fine. It's like sticking your finger in a sort of socket, you know, electric socket when you get it. Let's try a little bit higher, okay?
Okay, we'll put it up to 30.
Yep. Okay. Oh, Jesus! Yes, that hurt. Okay, right.
So just let your eyes relax completely. Every breath you take can help you relax deeper and deeper, deeper. Ever had the experience of what it's like to hold how cold your hand begins to come?
In my head, I'm snuggled up in bed.
And now I'm going to press the button. It's very good, very good. The arm's completely numb. Now, press that button again. Very good.
That blast was 4 times stronger than I could cope with unhypnotized.
I'd just like to check to see if it'd be all right to increase that level one more time.
I don't know. It's sort of, it's bordering on unpleasant.
2 and 1 in your own time. You can take all the time you want to come right the way back to the room. So open your eyes, come right the way back.
Ooh. Yep. Ooh. It was impressive. Before I jumped, I really jumped, it really hurt.
Yeah.
I didn't jump, I noticed it, it didn't really hurt. But there's some level at which I'm just still curious as to whether, if it really hurt, if you were drilling into my teeth, whether I would be able to get to a deep enough level.
You can close your eyes.
To get into a deep enough hypnotic state to be able to ignore serious pain normally requires a lot of preparatory work, so it's not a quick fix solution.
Right hand, palm up, large helium-filled balloon.
I'm after something faster and more effective.
Lifting it lighter and lighter, lifting it higher, higher and higher.
Now, alcohol is, of course, the traditional way of numbing the existential pain of life. But how well does it work when you're actually trying to numb the pain of pain? Here's one shot. I'm going to have a go until... Oh, that is so unpleasant. Could I have another, please? I can begin to feel the alcohol hit my system now.
I am not a drinker, and on an empty stomach it takes embarrassingly little to get me drunk.
2 vodkas, and about this time I feel like flirting. Hello. Sadly, the barmaid doesn't want to flirt, so instead I think what I'll probably do is induce some pain in myself for lack of anything else to do. Go on, how does that work? Here we go. Oh, no, wrong button. Right. Oh, God, that was still unpleasant. Okay, I think I probably need another vodka. Pour another one. You're looking more beautiful than ever. Down the hatch. Oh, God, that's horrible. It still tastes as horrible as it did the first time around. Where was I? And I'm really quite intoxicated now, though I'm still able to say the word intoxicated, which is impressed. So where was I? Pain. I think I've lost the train of thought, whatever. But it was very interesting. For a brief moment there, it was extremely interesting. So, pain. Yeah, alcohol. Am I being coherent? I'm not sure. Am I being coherent, Gemma? Am I saying sense? Does it make sense? Perfectly, great, yeah.
What I was trying to say was we all have receptors in our skin which respond to damage and send the ouch message along peripheral nerves, up the spinal cord and into our brains. Alcohol depresses the brain, so it doesn't respond so readily to the